I don't think you can have a healthcare system that is really about caring unless you have patients at the center of everything that it does. And I have to say, with something of a guilty conscience as a physician and former dean of medicine, sometimes we don't emphasize the caring enough, and sometimes I worry that we forget who we're serving. And I think all the panelists came to the view that we needed to refocus our healthcare systems across Canada on the needs of patients and families. A disintegrated system, one that operates in silos, will never serve the patient first and foremost. It will always be about each of the fiefdoms of the individual professionals or the institutions. And so if you think about the fact the system is poorly integrated, right there we have a signal being sent to the people we care for that says, well, you know, we'll operate our little practice over here, or we'll govern our little institution over here. But the patient isn't about the institution or the practice. The patient needs a continuity of care that extends from a hospital bed to a rehab hospital, to community rehabilitation, to home care, and on we go. So we were really struck by the need to think about everything in healthcare from the lens of how does this help the patient? How is this going to make the patient's experience of care better? How will this make his or her outcomes better? And I don't think we do enough of that. So our proposal, having looked at many positive projects across the country and internationally, was that we needed to begin to re-engage patients, not only at the individual clinical level, but in designing programs, thinking about institutions, patterns of care, and even thinking about the system as a whole. It's a missing piece. You look at so many industries, they're focused on their customers. Healthcare needs to rededicate itself to its customers, and that means our patients and their families. And let me say finally, we again saw all kinds of great evidence internationally of projects that have achieved improved outcomes for patients and families by really engaging the patient and their family in providing care. And we also saw some great work in Canada where with seniors, obviously an important target population, great work was being done to engage families in helping to care for seniors in partnership with healthcare professionals. So it's a great concept that I think we need to implement quickly. And one of the priorities for any new innovation center and for an innovation fund has to be thinking about how to refocus what we do around patients.